to be the editor-in-chief? All right, let's do this. Hello, and welcome back to Women for Wealth. So today I want to talk about something a little bit different. So I'm wearing a t-shirt today and I've got shorts on. You can't see the shorts, but just trust me, I'm wearing shorts. The weather is beautiful, the lake is calm, so we're going to take the boat out. And I was thinking, it's summertime, and in the summertime, because you're doing more activities, you're out and about more, there tend to be a little bit more emergencies. And I hope that does not happen to any of you. I truly do. But today I want to talk about ways to save on healthcare this summer. Because if you want to be wealthy, you need to be healthy. They just go hand in hand. The cost of medical care is just so outrageous that if you're not aware of that cost and you're not doing smart things to save money on healthcare, you could blow through your wealth very quickly. So now that it's summertime, let's talk about ways to manage healthcare expenses more effectively. So here's some practical tips. So one of the things is look into if your healthcare provider has free health advisors. So the company that I own, we actually offer this for free. So every employee, that you have to sign up for health care. If you don't have health benefits, you're not going to get a free health advisor. But if you have health benefits at all through my company, you have a free health advisor for you. Don't hesitate to reach out. They're available there to answer your questions and help you navigate your healthcare options. So that's the first thing. Make sure if you have a free health advisor available, you utilize that resource. We have Aetna health benefit plans. Health benefit plans across the board. I know Blue Cross Blue Shield also has this. But whatever healthcare plan you have, most of their websites have tools and tips designed to help reduce your out-of-pocket healthcare costs. So if you have Aetna, go to their website and look for ways to reduce your out-of-pocket healthcare cost. They're listed there for you. But let's talk about a couple of those. So know where to go. So choosing the right level of care can make a big financial difference. So urgent care is more affordable and typically faster for non-life-threatening issues such as burns, scrapes, fever, infections, fractures. As long as you don't have a bone protruding through your skin, anything like that, emergent care is going to be much more affordable and a lot faster. Now, if you have stroke-like conditions, chest pains, difficulty breathing, heavy bleeding, major trauma, you want to skip and go straight to the emergency room. ER visits come with significantly higher costs due to hospital overhead and critical care services. However, if it is a major condition, you want to go ahead and go to the ER. Just keep in mind, insurance copays for ER visits can run from $300 to $500, while urgent care can only be $30 to $75. So that is a huge, huge savings if you can go to urgent care instead of going directly to the ER. Another thing I want to mention is I do have a friend who is an ER doctor, and he said if you go to urgent care and urgent care then refers you to the ER, you actually get faster, better care because the urgent care has already done all of the pre-initial evaluation. They've already done a lot of the critical care services to stabilize you. And then by the time you get to the ER doctor already knows, okay, critical care, emergent care has already done all of this. That's done. This is their analysis. This is what they think it is. And then he can start treatment a lot quicker, a lot faster. So that's something else to think about. If you go to urgent care and then they refer you to an ER, according to this one particular friend of mine who's an ER doctor, he says you get better service that way. So, if you can save money and get treated better and get better service, maybe that's the way to go. But again, if you have any major conditions or anything severe, skip urgent care, go to the ER, get taken care of, save your life. So let's talk about a couple more ways you can reduce healthcare costs. So number one, preventive care. So make sure you're doing your checkups and vaccines and screenings and early detection, because early detection can prevent costly treatments later. Plus, it's going to improve your chances of full recovery. Make sure you're doing your preventive care. That's something that my husband and I started doing pretty much a year ago, we went to the doctor for the first time. We got all of our baselines. We got on some maintenance meds that we needed to take. There are a couple things that came up. He's going and having some follow-up things done. He's got to go have an MRI. Doesn't think there's anything there, but the doctor's being overly cautious. And she's like, you know what? If we can do early detection and we can catch something, that would be better for treatment. And so she wants to go ahead and do the MRI, even though there's low probability he has anything serious. She just wants to confirm and get ahead of it. Plus, if any time in the future something came up, he would already have the baseline scans to go back and reference. So, that's another thing. Do your preventative care. Getting your teeth cleaned every 6 months. I know. Everybody hates going to the dentist. I do too. I think it's very important, and I've learned my lesson on this. You need to go every 6 months and get your teeth professionally cleaned. You do your own flossing. We've got water picks, we've got toothbrushes. We have all that at home. We do the daily care, but going to a dentist and having your teeth professionally cleaned once every 6 months will actually prevent a lot of the other problems that you're going to have. So do your preventative care. The second thing, stay in network. Confirm providers are in network before you receive service. Because if you receive service from a doctor, a lab, a hospital, a dentist, anybody that's not in network, you're going to pay 2 to 4 times more money out of your pocket. I just recently had this. We went to a dentist that was local, and well, first of all, you want referral. So I asked friends, hey, what's a good dentist in the area that takes our insurance? And everybody said this particular dentist. Well, I called the dentist and asked, do you take this insurance? Yes, we do. We will file that insurance. Okay. And then schedule the appointment. I get to the appointment. Before I go back, I go up to the desk and I say, we're new patients. I just want to ask again. I just want to make sure that you're in network for my insurance. And she said, yes, we take your insurance. We are part of your insurance provider network. Okay. Then I get a letter in the mail from our insurance company that says, hey, don't know if you know this or not. This dentist is not in network. This dentist is not an approved provider. We do not cover this dentist at all. You have to pay 100% out of pocket. I was shocked. I called the dental office and I said, hey, I got this letter that says you're not in network. You're not even a approved provider and they're not going to cover any of these costs. And they was like, oh, we're sorry. We don't take that insurance anymore. Well, I asked multiple times. Why didn't anybody tell me that? I don't know, I'm sorry, but we're not part of that insurance network anymore. Okay, well then I need to cancel future appointments and I got to find me a new dentist. And that's what I did. One of the things I should have done and I have done since is I went back to my complimentary health advisor and I asked them for specific in-network dentists in the area, and I was given a list with addresses. Basically just Google and looked at their rating. How many stars did they have? And that's how I picked my next dentist. So I went to the insurance first, said, okay, who's your in-network providers? Got their list, then cross-referenced it with Google, how many stars they had, and then from the two lists, found a new dentist called. Yes, they were taking new patients, and so we now have appointments with them. But, you know, I had to pay out of pocket 100% for two cleanings that I would not have had to pay for at all. It was about $100 a piece. So I was out about $200 out of pocket for something that is covered under my insurance and would have been free to me if they had been part of my network. So keep that in mind. That was a $200 lesson that hurt. But, learn it from me so you don't make the same mistakes. The third thing you can do to reduce healthcare costs, compare prices of services. I just mentioned that my husband's got to have an MRI. One of the things that, I was able to do is I called my health advisor again, complimentary health advisor, and I said, hey, my husband has to have an MRI. What is the best hospital for that? I want positive reviews plus cost. And so it turned out that MUSC, the hospital that the doctor recommended, was the cheapest and did have the highest rating. So, that's what we're going to do. But you can compare prices for MRIs, lab tests, outpatient procedures. They can vary wildly. There's a couple of things that can help you. So one of them is Healthcare Blue Book, Good RX Care, and then of course I said my insurance. So I called my complimentary health advisor. So that's something else you can do. A fourth way to reduce healthcare costs is to use telehealth services. Virtual visits are often less expensive and just as effective for many common health concerns. If you've got a cold, if you've got something small, telehealth does great. I've used it at least twice. One time I used it, I had like contact dermatitis, basically a skin rash. And so I took a picture and I scheduled an appointment with a dermatologist. And virtually, I had the conversation with the dermatologist. I sent the pictures in, and she actually prescribed me medication that she sent to my local pharmacy, the pharmacist that I always use. So it was very convenient for me. I had to go pick up my regular monthly meds anyway. So I just picked up this, it was just a cortisol cream, and I picked up that prescription while I was there. Very easy, very convenient. It cost me at least $30 less than if I'd have made an appointment with my doctor, and it was a lot more convenient. I was able to stay in my pajamas. I didn't have to get out of the house. Cost of gas is kind of expensive right now. And that's one of the things I want to mention. We use Gas Buddy to save a couple of dollars here and there. I think last time we filled up the truck, we saved like 50 cents. It wasn't a lot using Gas Buddy, but it was something. So, look for gas saving options. And then also with CVS Pharmacy, they can mail us the frequent prescriptions. So if we've got a prescription that, has refills and automatically refills, they will put that on a mail plan for us. And it's cheaper for us to pay to have CVS mail it to us than it is for us to do the wear and tear on the vehicle, plus the gas, plus the time for us to drive into town, pick up the medicine at the pharmacy, and then drive back home. So think about that. Do those type of calculations. You know, 50 cent here, 50 cent there, it's not a lot of money, but it does add up over the year. 50 cent a week every week, not a ton of money, but it'll cover a date night for me and my husband, mainly cuz we don't ever go anywhere really expensive when we go out. But, any penny saved is a penny earned because if you're not spending it, you basically earned it again. So look at it that way. Some other things you can do to reduce your healthcare cost. Consider a high deductible health plan, an HDHP. In addition to that, add in a HSA. So if you're generally healthy, I tell people, if you're under the age of 40 and you're generally healthy, doing a HDHP along with a health savings account can save pre-tax dollars for future medical expenses. I highly advise this for anybody that's healthy under the age of 40. If you're 40, I do not recommend this. You don't have enough time with your HSA, and also, your high deductible health plan. If you're over 40, the likelihood that something major is going to happen, that's going to be a life event, unfortunately increases. So just be aware of that. You don't want to accidentally fall and break something and have to go to the hospital and get it set and then have a ton of out-of-pocket healthcare expense because you have a high deductible health plan. Again, if you have a health advisor that is free to you, talk to them. They're going to help you figure out based on your particular circumstances if a high deductible health plan plus an HSA is right for you. So, number 6, request generic medications. Generic medications can cost 80 to 85% less than brand name prescriptions. So always ask your healthcare provider about alternatives. Our doctor is really great, and we can talk to her and we could say, well, we'd like to try to save money, and she's like, okay, well, instead of this particular medication, there's this medication which is in the same family of medications, does the same thing, has similar symptoms and side effects. Do you want to consider this one, which has a generic option, instead of this brand name, which is brand new and really expensive? We always say yes. We always opt for the generic medication if it's available. But again, you have to ask these questions of your doctor and let your doctor know that you're looking to save money. Otherwise, they're gonna prescribe the brand new thing, the, most expensive thing. I've heard they get kickbacks from prescriptions. I don't know that, um, but it might be true. So again, I've never had a doctor that I said, "Hey, I need to save money. Can I get a generic of that prescription?" I've never had a doctor tell me no. So that's something else. And don't just tell your doctor, tell your pharmacist. My pharmacist at CVS, he'll ask me, "Hey, your doctor prescribed X. There's Y that has a generic equivalent. Do you want me to call your doctor and get your prescription changed for you?" And I'm like, "Absolutely, please do." And it saves me money. And so that's something else. Talk to your pharmacist. Let them know that you're looking for ways to save money. The seventh way to reduce your healthcare costs this summer is to negotiate medical bills. Don't pay a medical bill blindly. Review for errors, ask about discounts, ask for payment plans, and consider paying in cash for lower rates. So this is something that recently, I had to help my son navigate through. He had a odd medical thing that came up, had to go to the hospital. He's 30, he's healthy otherwise, and he does have a good budget in place, but they came back with it like a $10,000 bill. $10,000. And he was there for a couple hours. It was ridiculous. And so, of course, the first thing, review the bill, make sure there are no errors. If there are, say, "Hey, this looks fishy, this looks fishy. I didn't even take this. You charged me $120 for a pill here that you never even gave me. I never even took it." So look for those errors and have those conversations. Ask for discounts, ask for payment plans. Always be respectful. If you're nice and respectful, I found they'll always work with you. My son was able to take a $10,000 medical bill. He paid $5,000 cash. They accepted it as full payment, closed it out, and he doesn't have that over his head anymore. Now, he was able to do that because he had emergency savings account and he had money that he could use for that. Now he's going to have to rebuild his emergency savings account over time, but it's easier to make monthly payments to yourself in your emergency savings account than it is to make monthly payments to a hospital. So, negotiate your medical bills. Always be respectful and be kind and be nice, but usually they'll work with you. I've never had an instance where they didn't. Number 8, use discount prescription programs. Good RX or single care can offer substantial savings. Sometimes they're either even better than insurance pricing. So look into that. Check into that. I actually had one time a pharmacist tell me, "Hey, your insurance is going to be $7 for this. If you use GoodRx, you can do it for $3. Do you have a GoodRx plan?" And we actually did from years ago that I'd forgotten about, and it was attached to my profile. I guess we had a rewards points membership with them. And so she was able to pull it up and use it and save me $4. Number 9, go to a health clinic when appropriate. Community health centers and retail clinics, such as the CVS Minute Clinic, can provide basic care at lower cost. So I personally have been to a CVS Minute Clinic. I had really bad respiratory infection, and so I went to the CVS Minute Clinic. The CVS Minute Clinics, just be aware they cannot prescribe medications. They're not doctors, they're not even nurse practitioners. A lot of times they're just RNs, but they have a lot of knowledge. What they did is, number one, was a lot cheaper. They were immediate because it was walk-in. There was nobody else waiting, so I didn't have to call my doctor and get a appointment for 2 weeks later or anything crazy. I went in, I met with the Minute Clinic lady. She did the checks, and then she prescribed, and I say prescribed because again, she can't prescribe medication, but she gave me a recommended list of what to take that was over the counter. So over the counter, and there was one that she said, "Hey, if they have it available, there's a generic option on this over the counter medication. So that'll save you a few dollars there." So I saved money at the Minute Clinic because it was cheaper. I saved time because it was walk-in. I didn't have to schedule an appointment and then have to drive in and all that stuff. I was there, I just walked in. Number 3, I was able to get over-the-counter medication that was generic, so it was pennies on the dollar compared to going to a doctor. And number 4, unfortunately, I did not get better, and I did have to go to my regular doctor as a follow-up because I had developed pneumonia. My fault, I'll admit it. I'm a little bit too much of a workaholic. I did not slow down. I did not stop and let my body rest, and I ended up with pneumonia. But because I had gone to the minute clinic when I went to the doctor's like, "Okay, you've had this particular cold for this duration. I see where you went to the minute clinic and you took this and you're still not better, so let's check and see what else is happening." So that led my doctor to go ahead and do the chest x-ray to determine that I had the pneumonia, which if I had gone just to the doctor and not gone to the minute clinic, more than likely the doctor would have said, "You know what? Take this medication, rest, you'll be fine in 5 days." So it really worked out. It was a good thing that I had gone to the minute clinic because then the doctor went ahead and did the chest x-ray to find the pneumonia, which would not have been found otherwise. So that's my personal story about how going to a CVS Minute Clinic was beneficial. It saved me money, and I think I got better care as a result. And the last thing I want to recommend is prioritize wellness. Invest in healthy habits, nutrition, exercise, sleep, mental health, emotional health. Significantly reduce long-term health costs. The more you can do to reduce your stress and keep yourself healthy, the less time you're going to spend sick and the less time you're going to spend at a doctor's office or a hospital or wherever, and the less money you're going to have to spend long term. It's a lot cheaper to spend the money on wellness at the front than it is to spend money on, we'll call it sickness in the end. So focus on your wellness. Go ahead and, prioritize a little bit of money for good nutrition, exercise, sleep, mental health, emotional health. If you need some counseling, if you need some emotional and mental support, spend the money now and get it. Sleep. Just recently, my husband went and had a new CPAP issued to him because he has apnea real bad. That him getting good sleep and investing in a CPAP, that is actually going to help him stay healthier longer. So spend the money now to save the money later. Plus, you're going to be healthier and you're going to be well and you're going to feel better. You're going to enjoy your wealthy life. If you're sick, you can't enjoy your wealth. So focus on your health, focus on wellness, and use a couple of these ideas to try to reduce your healthcare costs this summer. I wish you health and wealth until next time. Thank you.